Joined live again this morning by Dr. Dana Hawkinson with the University of Kansas Health System to talk about that. So we're curious about that date this morning, Dr. Hawkinson, because sometimes it feels like from the outside some of these dates are just kind of picked at random. Does that speak to the peak in our area? What does that May 15th date look like compared to what the health numbers look like?
Yeah, the projections are always that. Projections, we can only go on the variables that are put into some of these computer models, but also the data at the time. Certainly, I think at the hospital and the health system here, we may be seeing a slight increase in our admissions. It's too early to tell, but the dates are really picked on various things, such as we know that the incubation period of this infection is probably about 2 weeks for most people. So there's a lot of 2-week ranges, and orders are put in for 2 weeks or so at a time. So that is one of the things. The other things is we just need to continue to get more data about hospitalizations, about critical illness and deaths. And so that's a pretty good range to pick. Again, Dr. Fauci has said it. It's not our timeline, it's the virus's timeline. So we're really working off that. We know that we need to get the economy going. We need to get our service people back to work. We need to do all that stuff, but we also need to be safe, keep people safe, keep our health system and our hospital services from being overwhelmed. And so that's really where those dates come in from.
Do you believe, Dr. Hawkinson, that deadline could need to be extended again? Or do you think if we peak at the end of April and we have another 2 weeks of that incubation period, we really may be able, from a medical perspective, to start reopening things?
Yeah, absolutely. That date could be extended. We would hope it isn't. And that's why I think these next 10 days or so are really going to be important for really seeing our numbers of hospitalizations, of infections, of critical illness, people needing the ventilator and ICU care. Are those going up? Are they staying the same? Or are they perhaps going down? So I think in that sense, yeah, these 2 weeks, that is why that will be so helpful and important to understand and know. But it certainly could be extended. We just don't know where the peak will be, and that's really what we want to find out.
And Dr. Hawkinson, we know so many people know this is frustrating news to hear this morning, so thank you for putting a medical lens on some of this news this morning.
Absolutely.